Well, thank you very much. It's certainly a pleasure to be here. So for more than 20 years, the CDC Injury Center has been doing work to prevent injuries across the lifespan. Really, prevention is our calling, and the prevention of youth sports concussion is one of the 4 key priority areas for the center right now. As you've heard, these are serious injuries with about 325,000 children and teens treated in an emergency department for sports and recreation-related TBIs in 2012. That's about 40 injuries every hour. Of course, we're science and data-driven at CDC. You'd expect nothing less, but we try to look beyond the injury itself to understand how these injuries occur. So I'm going to be discussing CDC's public health approach to traumatic brain injury. I'll outline current research priorities in concussion prevention, identification, and response. I'll also showcase some of the gaps in our understanding of the concussion burden here in the United States. So, like any good scientist, I shared my presentation with some colleagues at CDC before coming, and with the entire deck of slides that you're about to see, I got a couple of comments back, and the most common comment back was, "A Rumsfeld quote, Baldwin? Really?" So Donald Rumsfeld, I think it actually serves as nice edging for my presentation. He once said, "There are known knowns. These are the things that we know that we know. There are the known unknowns. That is to say, these are the things that we know we don't know. But there are also the unknown unknowns. These are the things we don't know we don't know." So I'm going to frame my presentation by what is known and unknown about concussion, knowledge, attitudes, and behaviors across a variety of audiences. And I think you'll hear that some of the key outcomes sort of reinforce some of the messaging from Coach Carr early this morning, as well as from some of the other speakers. So I want to begin by highlighting current CDC activities in the area. These highlights serve as markers for what we think at CDC are some of the key applied research priorities and how we're responding to them with our work at CDC. But the bulk of my presentation is drawn from 2 CDC publications released earlier this month. First, the Heads Up Opportunities to Reshape Culture Around Concussion provides a snapshot of current research on concussion knowledge and awareness and behaviors. I actually launched this on Tuesday in Garfield, New Jersey with Congressman Pascrell. And the second is CDC Injury Research Center Priorities, which outlines a set of targeted research priorities for the next 3 to 5 years that focus on addressing strategic gaps in the field. And obviously addressing these gaps is critical to reducing the burden of concussion among youth. And of course, I'll close with a detailed list of questions for all of us to work on together to answer. In the interest of my disclosures, this is not stock imagery. That is my 4-year-old son, Aaron, who learned how to ride his bike without training wheels for the first time a couple of weeks ago. And as a cyclist, obviously, I couldn't be prouder. This was mentioned earlier. This is the 2013 Institute of Medicine report on sports-related concussions, which included 2 CDC-focused recommendations. First, CDC was tasked with improving the tracking and monitoring of youth sports-related concussions. In a moment, I'm going to talk about some of the challenges and complexities and importance of getting these data. I'll also discuss CDC's plans to stand up a surveillance system. Of course, if we do this, we'll have a better sense of the problem because of improved data, but as important, we'll also know if our prevention efforts are making a difference. Second, CDC was asked to develop, implement, and evaluate the effectiveness of large-scale efforts to increase knowledge about concussion and help change the culture surrounding concussions. Later, I'll outline CDC's plans to evaluate programs that use our heads-up materials and our efforts to extend the scope of these programs to help change social norms. The White House Healthy Kids and Safe Sports Concussion Summit last May was a watershed moment for many of us in the field. And while there's been an ever-growing groundswell of awareness about concussion, including among the general population, which you've heard about already this morning, it's really something different entirely to have the President of the United States call it out. So it's galvanizing and invigorating, and as you're hearing, and as I think as a testament to why we're all here today, that momentum continues to grow. So the tracking and monitoring of disease and the risk factors for disease is really the core of CDC. It's the lifeblood, if you will, of CDC. And Alex Langmuir, a pioneer at CDC, once said, good surveillance data does not necessarily ensure you'll make the right decision, but it sure does reduce your chances of making the wrong ones. And the IOM recommended that the surveillance system capture information on a variety of topics listed here on this slide, including concussions occurring among children and adolescents across a wide age span, 5 to 21, a bunch of demographic information that you'd expect us to capture, pre-existing conditions, including ADHD and learning disabilities, concussion history, use of protective equipment, and the use of impact monitoring devices. And finally, IOM suggested we capture the cause, nature, and extent of the injuries, including specific signs and symptoms of concussions. If you think about it, that's actually an extremely tall order. As challenging, how do you capture the concussions that occur outside of organized sports leagues, as well as those that are not treated in doctors' offices, emergency departments, or urgent care settings? So a lot of what we talked about this morning are concussions that are occurring in organized leagues with athletic trainers and with a system in place behind it. But there really are a bulk of other concussions, from cycling to horseback riding and other sports and rec-related concussions that aren't captured in those data. So with additional funding, CDC plans to collect this information via a new household survey of parents. The survey will ask parents or caregivers to identify whether each of the children in the household has experienced a recent head injury, and that is within the last 6 to 12 months. They will then be asked to describe any symptoms they experienced as a result of the head injury. And for those head injuries that meet established symptom criteria, the parent or caregiver will be asked to describe the circumstances surrounding the concussion. While, of course, you can appreciate this is not a perfect system, we do think it's going to give us more information about concussion than we've ever had. So 10 years ago, CDC introduced the Heads Up initiative. We created it to help all the people in the lives of kids and teens, from parents to healthcare providers, from coaches to teachers, be better equipped to prevent, recognize, and respond to concussion. We wanted all of them to know what to do if someone in their care ever faces a brain injury. And it's obviously based on the latest science on concussion and has become one of the most sought after and popular initiatives that comes out of the Injury Center. And this is our recently published CDC Heads Up View book. The success of Heads Up is tied directly to the support of leading experts in the field, many of which are assembled here, a large group of partners, and continuous feedback from a variety of stakeholders. If you've ever interacted with CDC on concussion, a lot of special thanks goes to Kelly Sarmiento. She's a health communications person on my team, and she's really the brains and brawn really behind the Heads Up initiative. So the goal of the Heads Up initiative is to protect children and adolescents from concussion and other serious brain injuries by raising awareness, enhancing knowledge, and informing action to improve prevention, recognition, and response. And we do this in a couple of ways. First, translating the latest concussion science into educational products tailored specifically for each individual target audience, and working with partner organizations to disseminate and integrate concussion education materials and messages into their existing systems or programs. We've had a tremendous amount of reach, a reach that I think is actually quite staggering. So we've created over 50 products, distributed more than 6 million copies of our Heads Up materials. In association with some of the leagues that we work with, we've trained more than 3 million coaches. Kelly's really big on social media. We've actually connected with close to 40 million Americans on social media and made 215 million media impressions through print media and some of the TV PSAs that we've done. So that success continues today. So strengthening the connection between public health and clinical medicine is also a CDC priority right now. And one avenue to achieve this goal is through the development and rigorous implementation of guidelines. CDC is working to develop pediatric guidelines for the diagnosis and management of MTBI in children and teens. We joined with 40 leading experts in the field to create these guidelines, and to date, the group has reviewed 12,000 abstracts in addressing the 6 key clinical questions that we identified. We've used a systematic and graded process, and of course, broad dissemination is planned for the guidelines. The goal really of the guidelines is to promote consistent implementation by educating providers about the utility of the guidelines and to incorporate them into health IT and other clinical decision support tools. We hope to simplify, harmonize, standardize, and automate systems and practice protocols. It's been a long process for us, but we hope to publish these guidelines sometime early in 2016. Just a brief word about return to play. It's been talked a little bit about this morning, and I think there's going to be a nice presentation this afternoon as well. As you know, it's all 50 states have some type of return to play legislation. However, the specific legislation varies quite dramatically across states, and it's really unclear right now what the impact of that this legislation is actually having. It's also unclear what the most important components of the laws are at improving outcomes. So CDC is working on a study designed to evaluate the implementation and the impact of these laws among a national youth soccer organization. The main objective is to evaluate the implementation and impact and to determine their effect on improving knowledge and attitudes and behaviors of various sports stakeholders. Of particular interest to us is the effect on the identification and appropriate response to a potential TBI, and to find out if athletes return to play too soon before recovering fully from a concussion. We're also examining whether exposure to some of the heads-up materials that I showcased a minute ago is associated with improved outcomes. So here's a copy of the playbook that I spoke about a minute ago. While progress has been made, research suggests that too many young athletes still don't report their concussion symptoms, are not removed from play, and continue to play with symptoms and/or return to play too soon. We've heard a lot about that this morning already. We need to build a culture in sports where athletes take steps to lower their chances of getting a concussion and to recognize and report concussion symptoms so that they can get the care that they need and take time to recover fully. This involves really, for us, moving beyond general knowledge about concussion and changing the way we talk about and respond to concussions so that athletes know that they cannot play with a concussion or hide their symptoms. It involves coaches having detailed concussion action plans for practices and games that are rigorously followed. It involves parents who model and reinforce safe play and sportsmanship and follow the instructions of doctors if a concussion occurs. It involves healthcare providers using the evidence-based tools and guidelines so that athletes get the best care that they need. It involves school professionals. We haven't talked a lot this morning yet about return to learn. It involves school professionals helping students return to learn at a pace that works for them, offering them breaks and support as they need them. And finally, it involves athletes themselves having the wherewithal and the courage to report a concussion. I think we're seeing more and more of that today. So we created this Concussion at Play opportunities to reshape the culture around concussion, to provide a snapshot of current research on concussion knowledge and awareness, and young athletes' attitudes and behaviors about concussion. The bulk of the rest of my presentation is pulled from this report. And a very detailed set of reference slides are at the end. I didn't want to encumber these slides with all the references. So fortunately, most athletes have heard about concussion, but that said, young athletes may be unable to identify if their symptoms are caused by a concussion or another condition. Not surprisingly, athletes are more likely to report a concussion in practice when they feel less pressure that they're letting a coach or a teammate down. They're also less worried that they might lose their spot on the team. In one study, over 50% of athletes report that their coach didn't know that they had a concussion. And in another study, high school athletes were asked what would they do if they thought they had a concussion. The most common answer was that they would keep playing and see how they felt, or take a little break and return to play. Few athletes said they would stop playing entirely if they had concussion symptoms. And obviously, we really need to work to change that mindset. Coaches are increasingly aware of their role in concussion prevention, recognition, and management. Specifically, coaches feel that it's their responsibility to recognize a possible concussion and to remove an athlete from play. And yet, despite that, coaches may have difficulty identifying some concussion signs and symptoms, such as vision problems and sensitivity to light and noise. More training is needed, especially among part-time or weekend coaches who are coaching in non-school affiliated leagues and among coaches working in disadvantaged communities. Here access, and we heard a little bit about this already this morning, here access to certified athletic trainers and healthcare providers may not be as readily available as it would be in a more affluent community. So we know that athletes who receive positive messages from their coach and were praised for symptom reporting are more likely to report their concussion symptoms. And again, here, not surprisingly, the opposite is also true. Athletes who receive negative messages from their coaches are less likely to report their concussion symptoms. For coaches, talking about concussion and learning how to spot a concussion and what to do if a concussion is suspected really are important first steps. But if a concussion does occur, they need to support return to play responsibly. And more progress is needed, though. In one study, coaches were less likely to remove a young athlete from play when it was in a championship game. So just like coaches, we know parents do not always recognize post-concussive symptoms in their children when they appear. There's also a significant disparity between mothers and fathers on their views about the risks of concussion. Mothers are more likely to strongly agree than fathers that concussions are a critical issue. Despite a child, especially a teen's assertion to the contrary, parents do play a key role in influencing their children's behavior, including in concussion reporting. Part of this positive influence comes from parents serving as role models for safety behaviors, whether it's wearing a seatbelt and not texting and driving, or wearing a helmet when out on a bike ride. It's important to model, expect, and to reinforce safe play. Shifting to healthcare providers, we know that healthcare providers do not feel they have the adequate knowledge or training on concussion management, especially return to play protocols. This is especially true for primary care docs. Although guidelines exist, knowledge of and adherence to them is low in some specialties. CDC is working right now with the Children's Hospital of Philadelphia to look for ways to better integrate guidelines and clinical decision support tools into clinical workflow. Working with Epic, a large EHR vendor, they have smart sets for providers at the point of care. These are predefined lists of choices that providers can select from when someone presents with a concussion that ensures that that athlete gets the highest quality care. It also ensures their care plan is portable and up to date in their medical record. Finally, we know that current medical education often does not include an evidence-based curriculum on concussion, and few healthcare providers receive continuing medical education about it. CDC and others are working to change this as well. So teachers and other school professionals help nurture and inspire and enable our children to learn and meet their promise. They're really at the front line of our children's success, and this includes the key role that they play in helping an injured student get back on track and to return to learn. Helping a student slowly return to learning after a concussion can lower their chances of dealing with worsening symptoms and a longer recovery. When caring adults like teachers understand how to help injured students return to the learning process, they can help make a full recovery possible and quicker. Unfortunately, this is an area where there's limited research on the evidence of the effectiveness of return to learn strategies. Current research focuses on the importance of a multidisciplinary and team-based approach to facilitate students returning to the classroom. So now that I've given you a sense of what is known about concussion knowledge, attitudes, and behaviors, I want to highlight what are some of the unknowns. So we don't know how many sports and recreation-related concussions occur among youth each year. As I mentioned earlier, the current estimate of 325,000 concussions is likely a huge undercount. Is the number and rate of sports-related concussions changing over time, as Dr. Guskowitz highlighted? Is this a product of better awareness and care-seeking practices among patients, or is this a true increase? What % of concussions occur outside of organized school-based sports? As you know, the majority of non-medical-based surveillance comes from school-based data systems. What % are seen by healthcare providers, and where are they being seen? At CDC, we're especially interested in getting better counts of patients seen in primary and urgent care settings. I talked about athletes underreporting of concussion. So what barriers and facilitators influence athletes' reporting of concussion, and how can accurate reporting be improved? What is the reliability of self-reported concussion among different population groups and among sports participants of different ages? How reliable is parent and caregiver reporting? Obviously, this is a critical question for CDC, given our surveillance system plans and the detailed information that we hope to glean from it. Are there any novel approaches that can improve the reliability and quality of information reported? And finally, how can new technologies be leveraged to get more timely and better quality data, including about the trajectories of athletes who experience a concussion or multiple concussions? So shifting to concussion prevention, what are the impact of rule changes, changes in training practices, and changes in the sporting environment on concussions? Limits on checking in hockey or changes in the number and frequency of full pad practices in football obviously make sense. We need to understand the impact of these and other changes on concussion incidence and severity. What coaching strategies, like changes in playing technique or the use of protective equipment, are most useful? As important, how can the most effective strategies be brought to scale and become standards of practice across all states? How can we best influence parents and coaches' attitudes about concussion and ensure athletes feel empowered to report a concussion if one occurs? How can we change the social norm so that concussion reporting is supported by all stakeholders, including fellow athletes? What behavioral intervention strategies can be developed and tested that change the culture of sports? So beyond heads up, what local and tailored activities are most effective? Which primary prevention strategies to reduce concussions are most effective with various audiences, from players to coaches, teams, leagues, school staff, and families? As I've mentioned, each audience really requires a slightly different tact and a customized approach. How do public policies and other environmental factors influence knowledge, attitudes, and behaviors regarding concussion prevention? More rigorous evaluation is needed on return to play. And once model practices are identified, we need to enable dissemination and implementation of these best practices on a wider scale. And finally, we haven't talked much about this morning yet. There's the issue of cost. What are the costs of various TBI prevention strategies, and which are most cost effective? In this resource-constrained environment we live in, we need to look for and exploit the best buys and document the return on investments for our interventions. In our efforts to better identify concussions, how can education and awareness campaigns like CDC's Heads Up best complement environmental changes to reduce concussions? What role can teammates, coaches, and parents serve on increasing concussion reporting and care-seeking behavior? Having supportive coaches and teammates is critical to normalizing concussion reporting. How effective are trainings at promoting positive reporting behaviors among athletes? CDC, as I mentioned, has good data on the increases in knowledge from our Heads Up trainings. We know less about if and how they change the culture in sports. And finally, what strategies mitigate the barriers to concussion reporting and facilitate a positive, safety-focused environment? Here, we think a comprehensive and systems-level perspective is going to be most effective. In concussion response, what is the efficacy of state, community, and organizational policies, including return to play and return to learn laws and policies? What are the best practices for assisting young athletes with return to learn and effective approaches to improve school professionals' knowledge, attitudes, and behaviors regarding concussion? And what are the barriers, like cost and staffing, to implementing a return to learn process, and how can they be overcome? Finally, how effective are pediatric guidelines at improving recognition and management of MTBI? Do they enhance clinical decision-making? Once CDC releases our guidelines next year, we want to make sure we can document changes in practice and improved outcomes. What is the feasibility and utility of using clinical decision support tools like electronic health records to improve diagnosis and management of TBI? By the way, we see EHRs as a future source of surveillance data once they become more ubiquitous. What are the range of long-term and educational outcomes for children? And what risk and protective factors positively impact the trajectory of these outcomes? So getting back to the Rumsfeld quote, then there are the unknown unknowns. These are the things that we don't know. Here, investigator-initiated applied research is important. So please look for funding announcements on grants.gov and on the Injury Center homepage to help extend our knowledge horizon. So in conclusion, CDC is focused on understanding the burden, changing the culture of youth sports, and providing clinicians with guidance and clinical decision support tools. Of course, while we've made significant progress in knowledge about concussion, gaps remain in attitudes and behaviors across a variety of audiences to keep our athletes safe on the field and in the classroom. For research priorities, we need to better understand the burden, evaluate the effectiveness of existing interventions, test and implement strategies to change culture, and assess long-term outcomes of concussion. So let me close there, and thank you again for inviting me to be here today, and thank you to the University of Michigan and all the sponsors of this great event. Thank you.